Biden's symptoms continue to improve after COVID-19 diagnosis, physician says. CNN. President Joe Biden's symptoms continue to improve after being diagnosed Thursday with COVID-19, the president's physician said in a Saturday letter. His primary symptoms, though less troublesome, now include sore throat, rhinorrhea, loose cough, and body ache. Dr. Kevin O'Connor wrote, his voice remains deep, his pulse, blood pressure, respiratory rate, and temperature remain entirely normal. His oxygen saturation continues to be excellent on room air. His lungs remain clear. Biden completed his second full day of the Paxlovid on Friday night and will continue to receive the antiviral drug, O'Connor said. O'Connor wrote Biden's causative agent is most likely the BA5 COVID-19 variant, which he notes is responsible for 75 to 80% of infections in the United States at this time. Biden will continue to isolate in accordance with the Centers for Disease Control and Prevention called CDC recommendations, O'Connor said, and being treated with oral hydration, Tylenol, and low dose aspirin as the alternative type of blood thinner. O'Connor said Biden, who had asthma, he has he was younger, will also continue to be treated with his albuterol inhaler as needed, which he has used a few times since testing positive. White House Chief of Staff Lon Kulane said later Saturday during brief remarks Biden was feeling pretty well. Biden has been participating in virtual conference call meetings, Klein said, adding he's been on the phone. Klein did not respond when asked by CNN whether O'Connor would be speaking to reporters about the president's condition in the coming days. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, told CNN's Amara Walker on Saturday morning, we have a reason to believe that Biden will do very well. While he hadn't spoken directly to the president, Fauci said he's been in very close contact with O'Connor following Biden's positive test results this week. Fauci said Biden has no trouble breathing at all right now, and using an inhaler is what Biden does regularly when he gets an upper respiratory infection. At 79 years old, Biden is at an increased risk for a more severe case of COVID 19 due to his age, but he's fully vaccinated and twice boosted, which the CDC says reduce risk of hospitalization and death for older adults. O'Connor has been providing written updates about Biden's illness and health status, but has yet to publicly answer questions about it. The White House medical unit will continue to monitoring Biden closely, O'Connor said. First Lady Jill Biden, which is close contact to the president, tested negative for COVID-19 on Saturday. Her spokesperson, Michael LaLosa, said he's not experiencing any COVID-19 symptoms and remains at their home in Wilmington, Delaware. Thursday marked day zero of the president's COVID-19 timeline, meaning he would be in isolation until at least Tuesday in accordance to the CDC's guidelines. But Fauci confirmed to CNN Saturday Biden would be leaving isolation once he tested negative for COVID-19, straying from CDC guidance. You have to really go by the circumstances that you're in, Fauci said. The president is in the position to be able to test every day and wait wait till he becomes negative before he goes back. But that doesn't mean that everyone has to do that. This story has been updated with additional information. CNN's let Science contributed to this report.